Welcome to the University of Texas at Austin School of Nursing Health Worker Safety course. In this course, we will discuss the methods you as a nurse will use to keep yourself and your patient safe and healthy, including infection control, hand washing, needle safety, and preventing workplace injuries. You are required to watch the entire presentation and then make arrangements to complete the skills demonstration portions of the course at the time and place specified by UT School of Nursing personnel. These are the basic guidelines which will keep both you and your patients safe in the healthcare setting. We will discuss these more in depth as we continue. First, hand hygiene with an appropriate alcohol-based hand antiseptic or soap and water is an essential part of patient care and infection prevention and fundamental to patient safety. 2. Always know a patient's susceptibility to infection. 3. Recognize the elements of the chain of infection and initiate measures to prevent its onset and spread. 4. Practice fingernail hygiene. 5. Ensure that patients cover the mouth and nose when coughing or sneezing, and use and dispose of tissues properly. 6. Use clean gloves when you anticipate contact with body fluids, non-intact skin, or mucous membranes when there is a risk of drainage. To continue discussing safety guidelines, recognize the elements of the chain of infection and initiate measures to prevent its onset and spread. Healthcare workers should not wear artificial nails and extenders because of bacterial buildup. Fingernails should not be longer than 0.625 centimeters in length, and nail polish should not be chipped. There are no recommendations regarding nail polish color. Consistently incorporate the basic principles of medical asepsis into patient care. Ensure that patients, family members, and healthcare workers follow cough hygiene practices and cover their mouth and nose when coughing or sneezing, use tissues to contain respiratory secretions, dispose of tissues in the waste receptacle, and wash their hands. Use clean gloves when you anticipate contact with body fluids, non-intact skin, or mucous membranes when there is a risk of drainage. To continue discussing safety guidelines, use gown, mask, and eye protection when there is a splash risk. Protect fellow healthcare workers from exposure to infectious agents through proper use and disposal of equipment. Lastly, be aware of body sites where healthcare-associated infections, or HAIs, are most likely to develop, such as the urinary or respiratory tract. This enables you to direct preventive measures. Think to yourself how you would approach a coworker who is not following safety guidelines. Now we will go through these safety guidelines step by step. The first one is hand hygiene. Hand hygiene is a general term that applies to hand washing, antiseptic hand wash, antiseptic hand rub, or surgical hand antisepsis. Hand washing refers to washing hands with plain soap and water. An antiseptic hand wash is defined as washing hands with water and soap or other detergents containing an antiseptic agent. An antiseptic hand rub means applying an antiseptic hand rub product to all surfaces of the hands to reduce the numbers of microorganisms present. Surgical hand antisepsis is the use of an antiseptic hand wash or antiseptic hand rub before surgery by surgical personnel to eliminate transient and to reduce resident hand flora. Antiseptic detergent preparations often have persistent antimicrobial activity. Bundled interventions such as ongoing education, reminders such as posters, administrative support, wall-mounted alcohol dispensers, pocket-sized bottles, and more all improve hand hygiene practices. Recent research shows that hand washing with plain soap sometimes results in paradoxical increases in bacterial counts on the skin. Alcohol-based products are more effective than soap or antiseptic soaps for standard hand washing or hand antisepsis. Brisk alcohol-based rinses or gels containing emollients cause substantially less skin irritation and dryness than plain or antimicrobial soaps. Soap and water is still necessary for hand hygiene if hands are visibly soiled, or when the clinician is caring for patients infected with C. difficile. Think to yourself, what do you think the compliance rate is for hand hygiene among healthcare workers? One study in 2011 found that hand hygiene compliance among healthcare workers had an overall compliance rate below 40%. There are many consequences of not using proper hand hygiene. It is a critical responsibility of all healthcare workers. Wash hands with plain soap and water or with antibacterial soap and water when hands are visibly dirty or soiled with blood or other body fluids before eating and after using the toilet. Wash hands if exposed to spore-forming organisms. Examples of spore-forming organisms are Clostridium difficile and Bacillus anthracis. If hands are not visibly soiled, use an alcohol-based hand rub for routinely decontaminating hands in clinical situations. Some specific examples of times when you should do hand hygiene are before and after having direct contact with patients, before applying sterile gloves and inserting an invasive device such as an indwelling urinary catheter or a peripheral vascular catheter, after having contact with body fluids or excretions, mucous membranes, and non-intact skin, after having contact with wound dressings if hands are not visibly soiled, when moving from a contaminated body site to a clean body site during patient care, after having contact with inanimate objects such as medical equipment in the immediate vicinity of a patient, and after removing gloves. We now have a quick quiz question for you. Healthcare workers with chipped nail polish or long or artificial nails have high numbers of bacteria on their fingertips. Therefore, the CDC recommends A. Using only neutral colored, non-chip polish, B. Wearing gloves over artificial nails, C. Keeping natural nails less than 1/4 inch long, or D. Allowing extra time for hand washing to scrub nails. The correct answer is C. Keeping natural nails less than 1/4 inch long. Keeping nails short will limit collection of bacteria under the nails. While chipped nail polish is a contributor to higher numbers of bacteria, the color of the polish does not matter. Wearing gloves over artificial nails is not sufficient to protect patients from the transmission of bacteria that may inadvertently be picked up in the environment. Artificial nails might also cause a tear in the glove. Even with extra time spent on washing hands to scrub nails, bacteria are still more likely to exist under artificial nails. Another quiz question for you. When hands are not visibly soiled or contaminated with blood or body fluids, the nurse may use an alcohol-based hand rub to perform hand hygiene. True or false? The correct answer is A, true. Alcohol-based hand sanitizers have been shown to reduce infection in a variety of settings, from intensive care units to long-term care facilities. Alcohol-based rinses or gels containing emollients or moisturizers cause substantially less skin irritation and dryness than plain or antimicrobial soaps. You can now watch this video from the CDC on hand washing exercises. The next safety guideline involves understanding the chain of transmission of infection in the healthcare setting. Infection prevention involves measures to reduce or eliminate sources and transmission of infection, protecting patients and healthcare providers from disease. Hand hygiene practices are major principles of infection control and are essential to safe patient care. Patients in all healthcare settings are at risk of becoming colonized or infected as a result of an impaired immune response, exposure to increased numbers of pathogenic organisms, and performance of invasive procedures. Know a patient's susceptibility to infection. Age, nutritional status, stress, disease processes, and forms of medical therapy place patients at risk. Healthcare-associated infections, or HAIs, result from the delivery of health services in a healthcare setting and were not present at the time of admission. These infections are often more difficult to treat than community-acquired infections. A hospital is one of the most likely settings for acquiring an HAI because staff, patients, and environmental factors support a high population of pathogens that are resistant to antibiotics. Healthcare workers transmit many HAIs by direct contact during delivery of care. Although protecting patients from HAIs is an obvious priority, nurses are also at risk because of contact with infectious materials or exposure to a communicable disease. This slide shows the chain of infection. There are many different germs and infections inside and outside of the healthcare setting. Despite the variety of viruses and bacteria, germs spread from person to person through a common series of events. Therefore, to prevent germs from infecting more people, we must break the chain of infection. No matter the germ, there are 6 points at which the chain can be broken and a germ can be stopped from infecting another person. The 6 links include the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host. The infectious agent is the pathogen or germ that causes disease. The reservoir includes places in the environment where the pathogen lives. This includes people, animals and insects, medical equipment, and soil and water. The portal of exit is the way the infectious agent leaves the reservoir, through open wounds, aerosols, and the splatter of body fluids, including coughing, sneezing, and saliva. The mode of transmission is the way the infectious agent can be passed on, through direct or indirect contact, ingestion, or inhalation. The portal of entry is the way the infectious agent can enter a new host through broken skin, the respiratory tract, mucous membranes, and catheters and tubes. The susceptible host can be any person, the most vulnerable of whom are receiving healthcare, are immunocompromised, or have invasive medical devices, including lines, devices, and airways. The way to stop germs from spreading is by interrupting this chain at any link. Break the chain by cleaning your hands frequently, staying up to date on your vaccines, including the flu shot, covering coughs and sneezes, and staying home when sick, following the rules for standard and contact isolation, using personal protective equipment the right way, cleaning and disinfecting the environment, sterilizing medical instruments and equipment, following safe injection practices, and using antibiotics wisely to prevent antibiotic resistance. Isolation precautions use procedures to reduce cross-contamination to other patients. The CDC gives us our guidelines for these procedures. When a patient has a known or suspected source of colonization or infection, healthcare workers follow specific infection prevention and control practices to reduce the risk of cross-contamination to other patients. However, we also have a list of precautions that we follow for all patients, whether they have a known or suspected infection or not. Everyone who comes into the hospital environment is under what we call standard precautions. Standard precautions require you to wear clean gloves before coming in contact with mucous membranes, non-intact skin, blood, body fluids, or other infectious material. You wear clean gloves routinely when performing a variety of procedures, such as starting an IV or inserting any tubes into a patient. Masks are worn when there is a risk of splash during a procedure, or when certain sterile procedures, such as changing a central line dressing, are performed. Protective eyewear and masks become important when there is a risk of splash of blood or other body fluids to the eyes or mouth. Cough etiquette is part of standard precautions and includes these prevention measures. Cover your mouth and nose with a tissue when coughing or sneezing. Use the nearest waste receptacle to dispose of the tissue after use. And perform hand hygiene, such as hand washing with non-antimicrobial soap and water, alcohol-based hand rub, or antiseptic hand wash after having contact with respiratory secretions and contaminated objects and materials. Transmission-based precautions are used for the care of patients who are known or suspected to be infected or colonized with microorganisms transmitted by the contact, droplet, or airborne routes. Transmission-based precautions involves the use of gowns, gloves, and possibly masks and/or eye protection, depending on the type of isolation. The following 2 slides will discuss airborne, droplet, and contact isolation and the PPE, or personal protective equipment, needed for each. Keep in mind that the 3 types of transmission-based precautions may be combined for diseases that have multiple routes of transmission, such as chickenpox. When used either singly or in combination, you use them in addition to standard precautions. Contact precautions may be needed for germs that are spread by touching. Contact precautions help keep staff and visitors from spreading the germs after touching a person or an object that the person has touched. Anyone entering the room who may touch the person or objects in the room should wear a gown and gloves. Contact precautions also may involve enteric precautions, which we will discuss more in a moment. Droplet precautions are used to prevent contact with mucus and other secretions from the nose and sinuses, throat, airways, and lungs. When a person talks, sneezes, or coughs, droplets that contain germs can travel about 3 feet or 90 centimeters. Illnesses that require droplet precautions include influenza, pertussis or whooping cough, and mumps. Anyone who goes into the room should wear a surgical mask within 3 feet of the patient. Airborne precautions may be needed for germs that are so small they can float in the air and travel long distances. Airborne precautions help keep staff, visitors, and other people from breathing in these germs and getting sick. Germs that warrant airborne precautions include chickenpox, measles, and tuberculosis bacteria. Anyone who has these germs should be in special rooms where the air is gently sucked out and not allowed to flow into the hallway. This is called a negative pressure room. Anyone who goes into the room should put on a well-fitted respirator mask before they enter. Multi-drug-resistant organisms, or MDROs, include methicillin-resistant Staphylococcus aureus, or MRSA, and vancomycin-resistant Enterococcus, or VRE. In recent reports, MRSA caused upward of 19% of healthcare-associated bloodstream infections. No matter which MDRO is involved, the most common means of transmission is by way of a healthcare worker's hands. Use contact precautions when taking care of patients with MDROs. C. diff has a slightly different type of contact isolation, which we will discuss next, as it is a spore-forming organism. Another term you may hear that falls under the class of contact precautions is something called enteric precautions. These precautions are used for patients who have active infection with C. diff, rotavirus, or norovirus. Clostridium difficile is the most common cause of hospital-acquired infectious diarrhea. C. diff has been found in normal bowel flora, in abdominal wounds, and on the skin of hospital personnel. In fact, studies indicate that 3 to 10% of healthy individuals carry the organism without developing symptoms. This suggests that patients may enter the hospital already colonized by the organism and then develop disease after exposure to a second factor. This factor may be an antibiotic or other drug, such as chemotherapy, that alters the bowel's resistance or suppresses competing organisms in the bowel, thus favoring the growth of C. diff. It has been estimated that at least 1/3 of patients in large hospitals receive such drugs. Hospital spread of C. diff can occur through a variety of routes, including direct patient-to-patient contact, transmission between patients by the hands of hospital personnel, and contamination of the environment. A patient who has C. diff-associated diarrhea can easily shed the organism to the immediate environment. Spores may remain viable on environmental surfaces for months. Time for another quick quiz question. When observing contact isolation, gloves should be removed last to prevent microorganisms from being spread to the face after the gown has been removed. True or false? This is B, false. Contaminated gloves should be removed first to avoid contamination during the rest of the removal of PPE. After the removal, perform hand hygiene. Time for another question. Airborne precautions require a different mask than droplet isolation. True or false? The correct answer is A, true. Airborne precautions require an N95 mask that requires special fitting to ensure healthcare workers wear the right size. Droplet precautions require a standard face mask. Time to discuss needlestick prevention. The most frequent route of exposure to bloodborne disease for healthcare workers is needlestick injury. Research has shown that most needlestick injuries occur in patient rooms and in the operating room. Employers are required to maintain a current exposure control plan and seek employee input when considering changing medical devices. These injuries occur when healthcare workers recap needles, mishandle IV lines and needles, or leave needles at a patient's bedside. A sharp with engineered Sharps Injury Protection, or SESIP, is a device that is effective in preventing needle sticks. One type of SESIP is a blunt end cannula. Another is a safety syringe equipped with a plastic guard or sheath that slips over the needle as it is withdrawn from the skin. The guard immediately covers the needle, eliminating the chance for a needle stick injury. A variety of other SESIP devices are found in needleless IV line connection systems. Special puncture and leak-proof containers are available in healthcare agencies for the disposal of sharps. Containers are made so that only one hand needs to be used when disposing of an uncapped needle. In addition, containers must stand upright, must not be allowed to overfill, and must be colored red or labeled with a biohazard symbol. Do not ever reach into a container, do not try to put a needle into an overfilled container, and do not attempt to remove a container from a wall unit. Allow the proper personnel at your facility to handle the disposing of the containers. Be aware of non-needle sharps, such as glass ampules, surgical equipment, surgical blades, patient's fingernails, and suturing needles. Now we will discuss sprains, strains, and repetition injuries. This slide discusses the incidence of musculoskeletal disorders in healthcare, or MSDs. The most common MSDs reported by nurses and nursing aides are strains or sprains and injuries due to overexertion, such as lifting, pushing, or pulling, associated with patient handling tasks. Healthcare workers experience some of the highest rates of non-fatal occupational injuries and illnesses of any industry sector. OSHA reports that in 2012, injuries and illnesses reported for nursing and residential care workers were significantly higher than those in construction and 2 to 3 times higher than in retail or manufacturing. As many as 20% of nurses who leave direct patient care positions do so because of the risks of physical injury associated with the work. Direct and indirect costs associated with only back injuries in the healthcare industry are estimated to be $20 billion annually. In addition, healthcare employees who experience pain and fatigue may be less productive, less attentive, more susceptible to further injury, and may be more likely to affect the health and safety of others. Industries where patient handling tasks are performed include long-term care, which includes facilities that provide skilled or non-skilled nursing care, acute care, including hospitals, outpatient surgical centers, and clinics, home healthcare workers, and others, such as physical therapists, radiologists, and sonographers. Sprains and strains are the most often reported nature of injuries, and the shoulders and low back are the most affected body parts. The problem of lifting patients is compounded by the increasing weight of patients to be lifted due to the obesity epidemic in the United States and the rapidly increasing number of older people who require assistance with activities of daily living. Why is manual patient handling so hazardous? The physical demands of the nursing job include the weight of the patients we lift. The average man is 5'9" and 200 pounds, and the uneven body weight distribution between arms, legs, and trunk. When you combine this with the unpredictable nature of a confused, sick, or hurting patient, the amount of times per day nurses are required to move patients, and the often crowded, small spaces nurses work in, it is a recipe for a hazardous working environment. Nurses are often in a hurry, which means we don't use the modifications designed to make us safer, like raising the bed, lowering the side rails, or asking for help before lifting. Many of us are also active in our time outside of work, which can compound minor work injuries. Remember, using good body mechanics is not enough to prevent back injuries and other MSDs caused by manual patient handling. The physical effort required to repeatedly lift and move patients manually is greater than your musculoskeletal system can tolerate. Note this diagram of the spine, showing compression, rotation, and shearing forces that are impacting our spine when we manually lift and move patients. The bottom line is that there is no safe method to lift and transfer patients manually. Here are some examples of some common MSDs: strains and sprains in the neck, back, and shoulder, low back pain and sciatica, bulging or herniated spinal discs, carpal tunnel syndromes such as tendonitis and tenosynovitis in the upper extremities, epicondylitis such as tennis elbow or golfer's elbow, rotator cuff tears in the shoulder, and bursitis in the shoulder or knees. Primary risk factors for MSDs include force, awkward and static postures, and repetition. These are the forces which act on our bodies and compound the risk for musculoskeletal disorders. The force of the push-pull and awkward or static positions combined with the repetition required daily and the impact of these forces multiplied over time results in significant injury to our muscles, joints, tendons, and ligaments. On the next slides, we will discuss examples of these factors in the healthcare setting. Awkward posture and MSDs. Examples include providing medical care or performing personal hygiene tasks when the patient is in a chair or bed that is too low. Accessing medical equipment such as in-wall oxygen or suction equipment, and manually repositioning or transferring patients. Repetition in MSDs. This means performing the same motion over and over again. An example includes repeated positioning of patients in beds or transfers to chairs. Here are the higher risk tasks when patient handling. They include transferring from or to the bed to the chair or stretcher, manually moving the patient in the bed, manually lifting a patient from the floor, and attempting to stop falls. What can you do to reduce your risk of MSDs? Conduct a hazard or risk assessment. First, assess the patient. Second, assess and prepare the environment. Third, get necessary equipment and help. And fourth, perform the patient care task, lift or movement safely. When assessing the patient, The goal is to assess if the patient's status, physical and cognitive abilities included, has changed and to determine the safest method to transfer or move the patient. Compare assessment with patient handling orders or instructions in the patient's care plan and ensure that staff are alerted to changes in patient status. This brief observation includes assessment of the patient's ability to provide assistance, err on the side of caution, physical status or the ability to bear weight, upper extremity strength and coordination and balance, the ability for the patient to cooperate and follow instructions, and the patient's medical status, which includes changes in their diagnosis or symptoms, pain, fatigue, and medications. Assess and prepare the environment. Ensure that the path for transfer or movement is clear and remove obstacles and clutter that constrain use of good posture and access to the patient. This includes beds, tables, and chairs, trip hazards such as cords from medical equipment, and slip hazards such as spilled beverages or other fluids on the floor. Consider safe handling of medical devices such as catheters, intravenous tubing, oxygen tubing, and monitoring devices. Ensure good lighting. Adjust equipment such as beds to correct working height to promote good postures, and keep supplies close to the body to avoid long reaches. Get necessary equipment and help. Get the correct equipment and supplies for the task as determined in the patient care plan and after the patient assessment. Get additional help as required. Ensure that equipment is in good working order, devices such as gait belts and slings are in good condition and the correct size, and that the patient is wearing non-slip footwear if they are to be weight-bearing. Perform the patient care lift or movement safely. Explain the task to the patient. Agree on how much help he or she can give during the task. Position the equipment correctly, such as the height between a stretcher and a bed being equal. Apply brakes on equipment and furniture used. Lower the bed rails when necessary. You should receive training on the correct use of equipment, patient assessment, and safe work practices before handling patients. Coordinate the task as a team, including the nurses and the patient. Have the patient assist as much as they can. Use good body posture. Keep work close to the body and at optimal height. Know your physical limits and do not exceed them. What else can you do? You must report problems. You have to report your injury to your employer within 30 days from the date of the injury or from the date you knew your injury or illness was related to your job. If you do not notify your employer within these 30 days, your right to obtain benefits could be lost. Apply back injury prevention principles to your off-the-job activities and report any physical problems early. The earlier you report them, the quicker you can recover. Exposure to drugs and chemicals. All healthcare workers are at risk for exposure to chemicals and medications. Routes of exposure include absorption through the skin and absorption through mucous membranes, such as the eyes and mouth from splash. Types of chemical exposures include anti-neoplastic medications, such as cancer treatment or chemotherapy, medications used in reproduction or hormones, and other medications or substances, such as isopropyl alcohol and hydrogen peroxide. Some common medications that you will give as a healthcare worker that you will need to protect your skin from are chemotherapy in a pill form, nicotine patches, and testosterone in a patch or gel form. These also need to be disposed of in a special container that will be provided to you by your facility. Never dispose of these medications in a regular trash receptacle. All healthcare workers should know the location of the MSDs and notify leadership of all exposures even if unsure about the extent of the exposure. Immediately follow MSDs recommendations for the type of exposure. Know the location of the eye wash station. Here at the School of Nursing, the eye wash station is located in room 4.102 at the scrub sink. Now we will discuss workplace violence. More than 18 million healthcare workers today are at high risk to experience workplace violence. 80% are women. The National Institute for Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of assault directed towards persons at work or on duty. Workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening and disruptive behavior that occurs at the worksite. It can affect and involve workers, clients, customers, and visitors. Workplace violence ranges from threats and verbal abuse to physical assaults and even homicide. In 2010, the Bureau of Labor Statistics data reported healthcare and social assistance workers were the victims of approximately 11,370 assaults by persons, a greater than 13% increase over the number of such assaults reported in 2009. Almost 19%, or 2,130 of these assaults, occurred in nursing and residential care facilities alone. Unfortunately, many more incidents probably go unreported. Threats, or the intent to cause physical harm, can include verbal threats in person or by phone, or written threats by letter, by fax, or via text message on the cell phone. Assault is causing physical or emotional injury, pain, or distress. This includes hitting, slapping, punching, pushing, poking, and kicking. Also, shouting, name-calling, and the use of derogatory language. Assault may include use of a weapon of any kind. In general, anyone who works in a hospital or healthcare setting is at risk. Specifically, nurses and aides with the most direct contact with patients during mealtime, visiting hours, patient transportation, and administering care such as bathing are the most at risk. Visiting hour becomes more volatile because of family or interpersonal relationships between patients and their social network. This network becomes strained during times of illness, and nurses can easily become caught in the crossfire of confrontations. Patients, especially confused patients, become more agitated when being removed from their rooms to go for procedures, and they also become more agitated when they feel their personal space is being invaded during a bath. These are times of high stress for vulnerable patients, and they often lash out at their caregivers. Working with volatile people, such as those who are under the influence of alcohol or drugs, have a history of violence, or are diagnosed as psychotic, working when understaffed or working alone, transporting patients, long waits for service, overcrowded waiting rooms, poorly lit areas such as parking lots and corridors, inadequate security, and unrestricted movement of the public cause risks. Most of the characteristics you see in this slide are related to the emergency department. That is why there is usually a police or other uniformed officer on duty in most emergency departments. Before you seek employment at a healthcare facility, you should make sure they have developed a comprehensive prevention program that includes the following: a zero tolerance policy, a management commitment and enforcement, employee participation, hazard identification, training, hazard prevention, and accurate and timely reporting. Healthcare facilities should be engineered for the safety of both patients and healthcare workers. These features should include the installation of emergency alarms, signaling and monitoring systems, security devices such as metal detectors and cameras, better lighting, enclosed nurses' stations, and bulletproof or shatterproof glass enclosures at reception areas. There are some very important things your facility can do to minimize your risk of workplace violence. These include creating a buddy system, providing security escorts to parking lots, preventing personnel from working alone, restricting movement of the public using controlled access cards, training in hazard awareness, resolving conflicts, and recognizing potential signs, make counseling available to reduce workers' fear, and having open communication with workers. Be aware of any nonverbal signals your patients may give that they are at a high risk for violence. These include verbally expressed anger or frustration, body language or threatening gestures, signs of alcohol or drug use, or the presence of a weapon, such as a firearm or a knife. Here are some things that you can do as a healthcare worker to minimize your risk. Present a calm, caring attitude, don't match the threat, don't give orders, acknowledge what the person feels, avoid aggressive behavior, evaluate each situation, be vigilant, do not isolate yourself, and always keep an open path for exiting. When none of these methods work, remove yourself from the situation, call security for help, and report any violent situations to management. Our references came from the Center for Disease Control and Prevention.